Hello, and thank you for taking the time to review this video on our outpatient paperwork policies and procedure. The documentation is extremely similar for both if you see a client in the outpatient center and if you see a client in the school setting, so we will be covering the two of them together in this video. Let us begin with reviewing the Therapy Boss app, in which you will be documenting all the paperwork. You'll be getting very comfortable with it after we go over it in this video. To download the app, you would need to, if you're on your phone, you would be able to go to your Play Store and download it from there. If you're on a computer or a tablet and you'd like to download it from the website, you would go to therapyboss.com. You'll log in with your credentials, click Login, and then you will always have the option to install/update the Therapy Boss Clinician app. I have already done that on this computer. So that is the only time you will need the website. In general, you are always using the app to put all your documentation in. Let's pull up the app and see what it looks like. We're going to log in here. And we are going to begin with the first time you see a client in the clinic or in a school clinic. When you see a client the first time, you are going to have a 1-week authorization to make sure you have all your documents completed in a timely manner. Once we receive the parent's signature, which is stating that they consent to you seeing the client, we are going to take off that authorization period, and you'll be able to see your client for the next 3 months without any interruption. If the paperwork is not completed properly and we did not get a signature from the parent, you will receive a message when you try to put in your note, and it's going to state that you are outside your authorization period. This means the parent has not signed that you are able to see your client. So on the first visit, we will first review what you are going to do. So let's open up the patients. And for this, we are going to choose something called case management because it's just a dummy patient for us to work with. Now, you're going to choose that client from your case list, and here you're going to click on a new visit/activity. This is how you're going to be putting in your first visit is going to be called an assessment. So we're not looking at the first two, we're looking at the assessment for the first visit. You're going to put in the date that you're seeing the client and the time that you're seeing them. So in this case, let's say it was at 8 p.m. that you saw your client. You're going to click Save. Now, required in this assessment is going to be an evaluation and a session note. We are also going to require an admission consent, but we'll talk about that in a minute. First, on the bottom here, you would put in by the 0 minutes, you're going to put in how long it is. For an assessment, you have up to 60 minutes, although it will generally be 45 minutes. But you do have an option for 60 minutes just for an assessment. Every other visit would either be a 20 to 30 minute visit or a 45-minute visit. So once we put in the minutes, we are going to click the plus button and we are going to start with the social work evaluation. Now, when the social work evaluation gets pulled up, you're going to see that this is all about gathering information for this intake form. This social work evaluation, if you are being seen in the office, you would be meeting with the parents the first time, and you would be going through all these pieces of information with them. So the areas of concern might be in here, the desired outcomes, the diagnosis that you're working with. Again, remember, this is just a working diagnosis. This is never going to be a permanent diagnosis. Is there any treatment history that we want to include in here? Who does the child live with? Is there any history of problem behavior, abuse and neglect history? There are just different pieces here that you're going to fill out. Now, while you're working on this, I want you to notice that over here there is a red button. This is because we have not filled out everything. I'm not going to fill out everything in this situation, but the good news about that red button is that it will always tell you what you're missing. So if it's still red, there's one thing that you did wrong or that you didn't do. So you're going to make sure to include those in here. Now, 2 other important things that I'd like you to notice. This is also going to have your care plan in it. So that includes your goals and your interventions. So the goals, for example, we'll click on these. Now, best practice is always to include one of your own goals, and then the other 2 or 3 you would choose from here. So it's 3 dots over here. And there's different options for you, such as mental and emotional, anger management, anxiety. So let's say we would choose 2 anxiety goals, 1 anger management goal. Click OK. So it'll populate those, and then you would add in your own as well. You would type it in here and then click the plus button. So that would be your goals. Then in your interventions, you're going to have the same kind of concepts, which is, again, type in your own couple of interventions, such as perhaps develop rapport. That's always something that you would want to include as an intervention. And then you're going to click the plus button. And then you would also do those 3 dots and choose from some interventions. Now we are looking for more like 12 interventions, so 3 to 4 goals, and perhaps more like 10 to 12 interventions. So we're going to choose things that we think that this client could use. And obviously after we finish choosing, we would do from whichever areas you think are some of the desired outcomes, you would choose OK and click OK again. Now, as you're going through all this, at the end, you're going to see it says care plan developed in collaboration with the child and caregiver and agreed upon. And that's an important thing to check off there. If you did not discuss with an MD, which most of the time you will not have, you would not check that off. And then you would always look down at the not signed, and you would need to get a signature from the parent. Okay? The reason why you want to get a signature at the end of this note is because they need to review the care plan and make sure that they agree to it and that they agree that these are your goals and your interventions that you're going to be using. The visit frequency, let's just take a look at that. You would normally not see that because you would have gone in order, but type of evaluation is actually initial. And just looking at the frequency, it's asking what frequency do we believe is going to be used in seeing this client. So you would want to unlock the frequency here on the side. And what we are going to do for this visit, now because this is a client that I've been already seeing and this is a dummy client, it's not exactly how yours is going to look, which is just going to be zeros. What we would look at is that we would want between 4 and 8 visits a month, depending on what you assume you're going to be seeing this child. So it might be 4 visits a month if you think it's going to be once a week. If you're seeing the child once a week and the parent once a week, you would do 8 visits a month. If you think it's going to be some and some, that's why I chose 6. So it would just depend on how often you're seeing. And the first time that you're doing this, you're only doing the first 3 months, because that's how long your plan of care is going to act for. And then after 3 months, you're going to update your plan of care, which we'll talk about later on. So this would only be for the first 3 months that you're seeing the client. Again, in this case, that's not accurate because this is something that I've been seeing this client for longer. So again, now let's talk about for a moment. Now here's the difference between if this is something that the parent is doing with you or if this is something that you are in the school. Because if you're seeing the parent in the clinic and you're able to just get that signature, great. You just click on it and the parent signs it. What if you're in the school and you're trying to gather all this information? The way to gather this information is that you would be meeting with the principal, with the child, and calling the parent all within the same time frame to be able to get all this information. So you would spend 60 minutes gathering this information from different sources. And the signature, you still will need a signature here, so you can have the principal sign that form. So in this case, I'm going to say, and that would be the authorized representative. So they would sign it there, and then we would click save. Now, it still says obviously that we're missing things because, of course, I didn't fill out this entire evaluation. But let's continue on with here. Okay, we're going to click unlock because besides for that evaluation, we still have a couple of more things that we have to put in here. One of them is the admission consent. So we need to scroll through and have the parent or the principal recognize that all these pieces, they can review it, and then they click off that they did not refuse services and click save. So we have the admission consent, we have the social work evaluation. We are not done yet with our very first visit. Now we are looking at the social work session note. Now the social work session note, just to be clear, is something that you're going to be doing with every visit. So that evaluation and that admission consent, those are the two things that you're only doing for a first visit. The session note is something you're going to be doing for every visit there on forward. So what we're looking at here is there a makeup visit? Is there an insurance change that you that you're just aware of? Were there any risks and precautions? By those, we would usually mean, they have some options in here. I wrote that there's no risks and precautions, but if there's ever a suicidal or homicidal issue, we would not click none here. We would choose the risks and precautions. Now, these are not really necessarily what we will be finding, so you would really probably more go to other and choose the fact that it is suicidal and homicidal. 1 second, I'm sorry. When we choose other, we should have the option to type into it. We would click the plus button, and then here is where we would type suicidal ideation, and then of course you would have to comment on that, explain the situation, and also write the score of the Columbia suicide scale, which is what we do whenever a suicidal ideation comes up. So that's just something that I just always want to point out, that there is that risks and precautions. Who else is present is actually a voluntary field. It's optional. It's only if someone else is there, then you would put it down. So usually a first time visit, you will have other people there. But on a regular session, you would just leave this blank because none of these people are here. But if you, let's say, were meeting with the principal as well, you would click that off and write principal or the mother, etc. Is there any update that we need to be aware of? Were there any observations? Did the child come in seeming odd or strange or something happened? Now, let's say you're in the middle of this session. Now, this wouldn't be applicable, obviously, for the first session, but let's say you're in the middle of a third session and something new happens that you want to do a new intervention. You would click it here and you would just add a new intervention. So, for example, used drawing to express emotions. So we want to click that we did use that emotion. Now here is where we choose our interventions performed. So we're going to select our interventions. What did we use in this one session? Did we use this? Did we use this? And then they're always going to ask you for a little brief description on what you did here. So this is really where you want to include your snapshot of the session. So what can you describe about what happened in the session using those interventions? That is the interventions performed, and then you will always need to choose a progress towards a goal. So let's say your goal is just to get rid of anxiety. So you would choose that, and you would just want to write how is the child progressing towards that goal. So perhaps it's that the interventions performed help the child learn to minimize anxiety, or something along those lines. Were any goals achieved? That usually is not the case unless something really got fully completed and you're towards the end of your treatment. So in this case, we're going to say no. Were there any additional comments or instructions to caregiver given, meaning, please work on certain areas? Place of service, very important. No matter where you are, whether it is in the school or in the office, we are operating as an independent clinic within the school setting and in our office. So you must always choose independent clinic. If you choose anything else, these notes will not be approved and we will not be able to compensate for them. So your place of service must always say independent clinic. And if you have a plan for next visit, you would choose it. So now we did these 3 pieces, the evaluation, the admission consent, and the social session note. We did get it signed. So we are completed with this piece. Again, it says that we're not, only because we didn't fill out all the pieces. But when you fill them all out, you're going to see it turn green and it won't come up with that. So that is your typical normal first visit. Again, the signature part will be if you're seeing the parent, it would be with the parent. Even if you're in the school, best practice is to meet with the parent first and meet with the principal later. But if for some reason your first visit was only with the principal and the child, you would have the principal sign that first admission consent. We will reach out to the parent and get them to sign an additional admission consent to make sure that the parent actually agrees. Now, next piece is when we continue being seen. So if you're being seen for it's the next week and you want to see the child again, you're going to choose a new visit activity. And the type of note is important, which one you choose. The follow-up means that you are just seeing the child. So if it's a regular session, it can either be a 20 to 30 minute session or a 45-minute session. Either of those would go into the follow-up. If you are doing a collateral visit, which means that you are seeing the child and the parent, just the parent, the child, and then you're meeting with the teacher or the principal, those would all go under this group note. Now, they are the same note in terms of what you actually have to fill out, but in terms of which one you're choosing, it's very important to choose the proper note for what you're actually seeing. So in this case, let's say it was a collateral visit. It's not going to let me do this because we just did 219, so let's change it to as if we were seeing them 217. And again, it was a follow-up group note. And the only thing that's required here, a signature is not required for this. Obviously, you're going to have to put in the amount of time. So let's assume it's a 45-minute session. And we are choosing the social work session note. That is the only required note. You're going to click I accept. And again, you're going to just be putting in anything that you want to add as a new intervention. You're going to put in interventions performed from your regular plan of care. You're going to put in progress towards goals. Were there any goals achieved? Do you have instructions to caregiver, that place of service, and that plan for next visit? And you're going to click save. When you fill these all out, this red piece will turn green. If it's still red, it means it's not going to go through to us. So we're going to click save. And that is a note. Now, just one more piece that I do want to talk about. At the end of your 3 months, you are going to have, and you can always know when your end of 3 months is because you could look at the visit frequency and it will tell you when the time is going to be up. So for example, this one would be up starting April 30th. I would have to be ready to put in my new plan of care. So the way to do an updated plan of care is going to be that you would do a new non-visit document. So in the beginning, your first plan of care lasted for 3 months. Your second plan of care will last for 6 months. So right now, if let's say we were up to our 3 months and we need to put in a new plan of care, always do it before it's due so that you don't get locked out. You would just select a plan of care. You would click save. And very simply, you're going to choose goals and you're going to click on the continue unachieved goals. So these are just continued goals, assuming that you did continue them. If you wanted to add or change, this would be the place to add or change those goals. And then you would click OK. Same with the interventions. So we're going to continue them because in this case, obviously, I don't have any changes, but usually you might go in and finish one or, say that you achieved one or add a new one, etc. or added a couple. And then the visit frequency, you're going to give yourself, you're going to set the frequency and you're going to add another 6 months. So you're going to click on the unlock button on the bottom and you're going to click add month for 6 more months. So that is that piece with the updated plan of care. Now, along with the updated plan of care, you need to get a parent to sign that they saw this plan of care and that they agreed with it. So whenever you're doing this plan of care, you want to make sure that you have a visit note for a date, either a day before or a day after, whenever you're seeing the parent within that week. And in that plan of care, in that social work session note, so let's assume that we have this updated plan of care for 219, and here we have 217 that we met with the parent, right? So what we would put in that note would look like this, very important. In the interventions performed, I would do a change to care plan, a new intervention, which says parent reviewed and signed that they agreed to plan of care dated 2/19/2020. Put the little plus. So that's a intervention that you now included into your note. And in your interventions performed, you are going to make sure to choose that you did do that. So parent reviewed and signed that they agreed. And how do they sign? Right over here. Even though it says not required, you are still able to get the signature by making sure that both of these boxes are not checked. If you check this one, it won't allow you to sign. If you check this one, it won't allow you to sign. If you uncheck both of them, then you have the space to sign it. Now, in our office, we have tablets that you're able to use for this. If you're in a school, you would use your phone for the parent to be able to sign with their finger. They would click OK, and now they signed that they reviewed the plan of care dated 2/19. This actually would not work because this is dated 2/17. So how did they look at a visit that was 2 days in advance? So you would make sure that they're signing it for something that they saw, right? So we're going to click save. Again, it keeps saying this because it just, you know what, I do want to show you what it looks like. Let's take a look what it's telling me we're missing here. So we're missing observations, progress towards goals, and like I want you to see it turn green. So let's say we were to write this and we would to say client was able to discuss important pieces of their anxiety, etc., whatever their goal, whatever progress they made that day. So we're going to click OK. And place of service we did not choose, would always be independent clinic. Clicking OK. There we go. Voila, it turned green, which means that it will go through to us. So you're going to click save. Is this activity complete? You would click yes. So that is the ins and outs of all the paperwork that you're going to need, including the updated plan of care, the follow-ups, etc. The last few things that you need to know is this top button over here. This is the green synchronize button. Without you clicking this, we will not get any of your notes. They are due Monday by 2 p.m. in order for them to be included in payroll. So always make sure to upload all your notes. It's best practice to upload a note right after you see the client and click the green sync button. If for some reason your week is getting by and 1 week you have trouble and you get them all in before Monday at 2, that's fine too. As long as it's there by Monday at 2, you click the synchronize button, it's going to say send and receive, and you will get whatever new information we're giving to you, and you will also be sending over that information to us. So let's wait till that's completed. Takes about a minute. Synchronization completed. The only last thing that you will need is when you finish a patient, you must always choose a certain type of visit. The last time that you see a client, you would call it a discharge visit. So it's almost the same as a regular visit, except that you're going to have to put in a brief discharge summary. Again, we are we need to be able to not be overlapping the ones we're doing before. So the only things that are different in a discharge is that it's going to be a regular session note like you always do, but then it'll also ask you for a discharge summary, which is just why are we discharging this patient, what went on. Make sure to put in the right amount of minutes and click save, and that's the way that you get rid of that client, that it is no longer popping up in your caseload. So that's a very important thing for your last visit, and it's going to look like this, a discharge summary. That is all. Thank you so much for watching. Again, I would have to synchronize in order to get everything over there, but thank you so much for watching. It was a pleasure working with you.